Good morning, afternoon, evening, everyone. Today, I will be discussing a critical and increasingly urgent global health issue, antimicrobial resistance, commonly referred to as AMR. AMR occurs when microorganisms such as bacteria, viruses, fungi, and parasites undergo genetic changes that enable them to survive exposure to antimicrobial drugs that would normally kill them or inhibit their growth. This resistance compromises the efficacy of treatments, making infections more difficult to treat, which can result in prolonged illness, higher healthcare costs, and an increase in mortality rates. To put this in perspective, the World Health Organization has identified AMR as one of the top 10 global public health threats facing humanity. Without effective antimicrobials, the success of major surgeries and cancer chemotherapy would be jeopardized, and organ transplantation could become too risky. The rise of AMR is driven by factors including the overuse and misuse of antibiotics, both in humans and in agriculture, and is exacerbated by the lack of new antibiotics in the development pipeline. The measurement of antibiotic resistance is a critical component of managing and controlling AMR. The Clinical and Laboratory Standards Institute, or CLSI, plays a pivotal role in this process. It provides internationally recognized guidelines for performing antimicrobial susceptibility testing, which is the method used to determine if a particular bacterial strain is resistant or sensitive to a specific antibiotic. This testing involves growing bacteria isolated from patient samples on agar plates, followed by placing antibiotic-impregnated discs on the surface. The antibiotic diffuses into the agar, creating a gradient. If the bacteria are susceptible to the antibiotic, they will be inhibited from growing near the disc, creating a clear zone known as the zone of inhibition. CLSI establishes standardized criteria for these zones based on clinical data to determine whether the bacteria are susceptible, intermediate, or resistant to the antibiotic. Moreover, CLSI continuously updates these standards based on new research and emerging resistance patterns. This ensures that the susceptibility tests remain relevant and accurate in guiding treatment decisions, thereby helping to curb the spread of resistant strains. The development of antibiotic resistance is a complex process that is primarily driven by selective pressure. When antibiotics are used, they kill susceptible bacteria, but resistant ones may survive and multiply. Several key factors contribute to this process. The inappropriate or excessive use of antibiotics is one of the most significant drivers of resistance. This includes prescribing antibiotics for viral infections like the common cold, where they have no effect, and using broad-spectrum antibiotics when a narrow-spectrum one would suffice. Over time, this indiscriminate use promotes the survival of resistant bacteria. Patients not completing their prescribed course of antibiotics is another critical factor. When antibiotics are stopped prematurely, not all the bacteria may be killed. The surviving bacteria, which are often the most resilient, can then multiply and spread, leading to the development of resistant strains. The use of antibiotics in agriculture, particularly in livestock for growth promotion and disease prevention, is a major contributor to AMR. These antibiotics can create a reservoir of resistant bacteria in animals, which can then be transmitted to humans through the food chain, direct contact, or the environment. Inadequate infection control practices, especially in healthcare settings, facilitate the spread of resistant bacteria. This includes improper hand hygiene, the misuse of personal protective equipment, and insufficient cleaning and disinfection of medical equipment and surfaces. These lapses can lead to outbreaks of resistant infections, particularly in vulnerable populations. One of the critical misuses of antibiotics is the lack of routine culture sensitivity testing before prescribing antibiotics. Culture sensitivity testing involves isolating the causative microorganism from a patient's sample and testing its susceptibility to various antibiotics. This process helps in selecting the most effective antibiotic for treatment. When this testing is bypassed, clinicians may prescribe broad-spectrum antibiotics or those that the bacteria are already resistant to. This not only fails to treat the infection effectively, but also contributes to the development of resistance. Bacteria can develop resistance through several mechanisms. Some bacteria produce enzymes, such as beta-lactamases, that can inactivate antibiotics. For example, Beta-lactamase enzymes break down the beta-lactam ring found in penicillins and cephalosporins, rendering them ineffective. Alter the target site of the antibiotic, such as modifying penicillin-binding proteins, PBPs, in the case of methicillin-resistant Staphylococcus aureus, MRSA. This modification prevents the antibiotic from binding effectively, reducing its ability to kill the bacteria. Bacteria may produce excess quantities of the antibiotic's target, diluting the effect of the drug. For instance, overproduction of dihydropteroate synthase in bacteria can lead to resistance to sulfonamides. Bacteria can acquire genes that encode alternative versions of the target protein, which are not affected by the antibiotic. Bacteria can develop efflux pumps that actively expel the antibiotic from the cell, or they can modify their cell membrane to reduce permeability, preventing the antibiotic from entering the cell. This mechanism is commonly seen in multi-drug-resistant MDR bacteria. Accurate diagnosis and targeted antibiotic therapy are essential for managing infections and preventing the spread of resistant bacteria. This requires the collection of appropriate samples for culture and sensitivity testing. Common types of samples include milk is used in veterinary diagnostics, particularly for detecting mastitis in dairy cattle. Mastitis-causing bacteria, such as Staphylococcus aureus, can develop resistance to commonly used antibiotics, complicating treatment. Blood cultures are critical for diagnosing bacteremia or sepsis, where bacteria are present in the bloodstream. Rapid identification and susceptibility testing are crucial for initiating effective treatment and reducing mortality. Urine is typically tested for urinary tract infections, UTIs. Common UTI pathogens like Escherichia coli have shown increasing resistance to first-line antibiotics, making culture sensitivity testing essential for appropriate therapy. These are used to diagnose gastrointestinal infections caused by bacteria such as Salmonella, Shigella, and Clostridioides difficile. Antibiotic resistance in these pathogens can lead to severe and persistent infections. Collected from abscesses or wound infections to identify the causative bacteria. For example, methicillin-resistant Staphylococcus aureus, MRSA, is a common pathogen in skin soft tissue infections that requires specific antibiotic therapy. Samples such as sputum are used to diagnose respiratory infections, including pneumonia. Resistant strains of bacteria like Pseudomonas aeruginosa and Klebsiella pneumoniae are particularly concerning in hospital settings. CSF samples are essential for diagnosing central nervous system infections, such as meningitis, where rapid identification and sensitivity testing of the pathogen can be life-saving. In the fight against AMR, technology and data sharing play increasingly important roles. One proposed solution is the development of a result-sharing platform that allows laboratories to share antimicrobial susceptibility data with clinicians in real time. This could be an app or a web-based platform that provides access to updated resistance patterns across different regions and healthcare settings. Such a platform would benefit clinicians who do not have immediate access to culture sensitivity testing by allowing them to make informed decisions based on collective data. This can help in avoiding the use of antibiotics that have a high likelihood of resistance, thus preserving the effectiveness of existing antibiotics. Moreover, the platform could be integrated with national or regional surveillance systems, contributing to a larger database that tracks the spread of resistant strains. This would enable public health authorities to identify emerging resistance trends and implement targeted interventions, such as updated treatment guidelines or infection control measures. Thank you for your attention. Antimicrobial resistance is a multifaceted and rapidly